So this first bit of the general ward is surgical.
So we're on the first floor.
First floor. And this is the dedicated lift I was talking about. So
Yep.
that lift will link this floor maternity with theatre. So this arrives directly in theatre.
Gosh.
Okay. A staff station, and at the back here, you'll find in wards that everybody's jostling for space and having access to computers. So what we did was design the space here. We will have 6 workstations at the back, and people can use this.
Which will take the pressure off the front desk.
Off the front desk, yes.
Well, actually, that makes sense.
And what we've done here is we've got 2 high dependency units. So if somebody's had major surgery, they can come into this unit. What we've done is we've moved the ensuite to the back, rather than so that we can see the patients, observe them, and make sure that in fact they are not deteriorating.
Everything's under control.
Yeah.
So you have 2 units like that. There's another one there,
Yeah,
isn't there?
we have another one there. So all of these are double bedders with en suites, and on the other side we'll just walk around. So as you go through that door, there's a change now into medical. So again, we have another substation here, and we have natural light through this big skylight.
So what's the difference between medical and surgical? What does that mean?
So surgical is people that usually have surgery and have operations done. So they will in fact be in that first bit.
Yes.
So people with things like strokes, pneumonia,
They're medical, are they?
attacks, they're all medical.
Thank you for that.
And they'll be in this area.
Right.
Yeah.
Gosh. Once again, great light coming through. Would you expect the place to be busy from a numbers point of view, or do you think?
I think that we could have done with more beds.
I guess that's always the way.
Yeah, and what we've done is we've started to work in the whole old hospital with the same number of beds, just to test.
To see how it goes.
Yeah.
Okay, that's a good idea.
So this is what we're trying to do. So we're hoping that in fact when we move in here, and remember that we've also got the acute assessment unit.
Yes.
So we've got another 4 beds there. And we also on the outside, which I haven't shown you, is that we've got what we call transition cottages. So we've got 4 cottages that are like motel units. And if somebody, and especially for coasters, because of distance, we think that if somebody does not need to be in the ward, and let's say they haven't been, it's not convenient for family to pick them up, or if we think, they live down in Haas, it's such a long way, maybe we should just observe them for another day, maybe 2 days. Then we can put them into the transition units.
And of course, when the old hospital comes down, as Greymouth grows, which I think it will,
yes,
there's room for expansion if you have to.
Correct. So in fact, the architects have already designed expansion into the building.
Love it.
Yep.
Wow. Well, it's that forward thinking that's just worth everything.
This is the palliative care unit. So people that will be admitted for care end of life will be admitted into this area. You can see it's got its own beverage bay, television, it's got a lift and an ensuite. And it's also got comfortable chairs.
So palliative care is pretty much where you're not going to make it.
No, yeah,
Okay.
it's end of life.
Yeah, I understand.
Yeah. So we try to make this again as comfortable as possible.
Oh. And you'll be able to check who's at New World and whether it's busy or not. And when the sun comes over the hill there, yeah, that'll be all right.
You can see in that room, the hoist will take you directly into the ensuite.
Oh, so that's from the shower.
Yes, yeah. So that means you don't have to lift or carry the patient.
Oh wow, what a great idea.
Yeah, it'll take you directly to the toilet.
And then back into bed. Oh, there's the odd occasion when I reckon I could use one of these at home. Very upmarket, coasters. It really is. It's this has been a brilliant experience.
Critical care unit. So again, like in the emergency department, we have an isolation room. It's set up the same way, negative pressure, and it's for people with that are contagious.
Yep.
So either viral or bacterial, and they'll go into this area. We have 3 bays for critical care patients.
So what's a critical care patient likely to look like? What does that mean?
Somebody that's sort of had a heart attack and maybe
Gotcha.
they are
Yep.
unstable.
Yeah.
People that need resuscitation or intensive care, one-on-one care. So they'll be admitted into this area.
And on the desk there, there'll be 1 or 2
Yes.
nurses,
Staff.
I guess, staff.
Yeah, staff, yeah.
Gosh, quite intense, isn't it? Actually, with nobody here, it's quite intense.
I'm not sure of the date, you've not just said the date on when we
Entry into the plant room. And you can see my swipes, it works.